For many Kentucky families, daycare for their kids can rival tuition at a state community college. The cost of it, that is. Kentucky's largest advocacy group for business says the state's economy would get a big boost if childcare was much more accessible and affordable. The Kentucky Chamber of Commerce has produced a report on what a more robust childcare landscape would mean for Kentucky and testified earlier this week to a legislative panel in Frankfort about the hundreds of millions of dollars the state would gain in wages, sales tax, and income tax revenues if childcare wasn't the barrier it is now for many Kentucky families. Kate Shanks, Senior Vice President of Public Affairs for the Kentucky Chamber, stopped by our studios yesterday to tell us more. That is tonight's Business Beat segment.
I can tell you a friend of mine pays $400 a week for her infant in childcare. I was talking to someone today who's expecting a child and is on a list and will expect to pay $300 a week. So you're looking at what, $1,200–$1,600 a month. In some parts of Kentucky, it might be less, maybe $8,000 to $10,000 a year. And it's going to depend on the age of the child. So infants, of course, require more care than older kids. So as a parent, you get to see those child care costs drop a little bit. But, I think our community college system is very competitive, and there's a lot of great scholarships and grants available. So I would expect that, parents are paying more in some instances in Kentucky, given the care that they have. It is significantly more than what I paid. My children are much older. When I hear those numbers, I don't know how I would have done it, but we do have some new programs on the books. We have the Employee Child Care Assistance Partnership, started a few years ago. Representative Samara Heavrin championed that bill. An employer can provide a child care benefit, and the state will match it up to dollar for dollar to help the employee reduce the cost of child care. We have the Child Care Assistance Program, which is for individuals at certain income levels, and we have extended that program to child care workers as a really great benefit to attract people to that profession. And so what one of the reports did that we published last week was to look at what happens if we reduce the cost of child care per month for families. And we had researchers, we work with the University of Kentucky, Blueprint Kentucky, and we modeled it. And so we modeled a handful of different scenarios where we reduce the cost of child care per month. And what we found is on the high end, we can get around 16,000 to 28,000 Kentuckians back in the workforce.
Wow, mostly women?
This is a significant amount of women, some fathers too, but you do see that arrangement where you have moms rejoining in the model that we did. And what we have found, if we can hit 28,000 Kentuckians, we can bring them back into the workforce. We can bring Kentucky off the bottom 10 of states for workforce participation.
Which was where we've been stuck for a while.
Forever, it seems. It's a very stubborn problem. We can also generate about $1.1 billion in economic impact through wages and taxes generated from wages and spending in the economy. And what we didn't measure, but we know is there, is some of those families may be on public services such as Medicaid, and hopefully they're moving to self-sufficiency where they're not on those programs anymore. So that can have an effect as well. And so, it's a significant issue for Kentucky. We have around 320,000 Kentuckians who are prime working age Kentuckians, 25 to 54, who are not in the workforce. Undoubtedly, some people will choose not to work. But for those that face barriers to work, we want to remove those barriers so that we can get them into the workforce.
In the Chamber's child care report, it was noted that in 37 rural counties, more than half of children potentially needing care lack available slots. The report also found that families with multiple children in regulated child care may spend 20 to 40% of their income on that care. We'll have more about this examination of child care in Kentucky next week on Kentucky Edition.